proud to be the country that is rolling out the fastest in the world. And I think it's useful for other countries to understand what are the factors that have contributed to the success and to learn from that. We're a relatively small population. We're under 10 million people. So in terms of logistics, it's actually easier than other countries. The response is very centralized. So the decisions are made at central government and are applied in the whole country. The other thing is we have probably one of the strongest data-driven health systems in the world, in the sense that it's very easy to identify who's eligible, to invite them, to send them text messages, to document who's been vaccinated, and to invite again people who've missed out. Israeli people are very resourceful, and what you've seen, for example, is very quickly WhatsApp group being set up to identify where there are leftover doses, so people will go and queue at the end of the day to get the leftover doses. That means a more rapid take-up, but also very, very little wastage.
We've really sort of put our stock in vaccines in this country to control the epidemic. You have the most reported cases and the most reported deaths of any country because we really never got community transmission under control. One thing we've done really well is that we accelerated the development and then the approval of vaccines. It's well known now, I think, that vaccines were developed in record time without cutting corners in terms of safety, and have been phenomenally effective. So that was a real success, but as it turns out, there wasn't really a national plan to get the vaccines distributed and into people's arms. So we did have a chaotic start to the rollout. But now, with the new administration, there's a federal plan. Vaccines are rolling out on the order of about 1.4 million doses a day now. So things are really, really picking up. There's still a fairly large group of people who say they won't take the vaccine. And that's particularly concerning in healthcare facilities. So we've seen healthcare workers in nursing homes and other long-term care facilities not taking up the vaccine at the levels that we would hope. And so that's a legitimate concern.
There's no doubt the numbers have been distressingly high in terms of cases and deaths. But when we come to the vaccine program, I think things have gone well. The government has made a commitment to vaccinate the first 4 levels of priority by the 15th of February. That means about 14 or 15 million people, and we're about 8 million. So it's going great guns, and I think we'll probably get there. The best thing you can do in public health terms is to make sure that as many people as possible have actually had at least one vaccine dose. You will do a lot more good in population protection by extending the net widely, and doing that by extending the gap between the 2 doses. This was a bit controversial at times, but it turns out that there's good evidence that the antibody response to the second dose is stronger if there's a longer interval between the 2 injections than a shorter interval. So it seems pretty clear that individuals are not going to be disadvantaged.